Dog first aid. Basic techniques. First of all, the purpose of a first aid is to help a dog that is suffering in an emergency situation. These techniques may always relieve pain and/or discomfort, but always require a veterinary supervision. The purpose of this video is to understand the basic of first aid techniques to perform them in case of emergency if there are no doctors or veterinary nurses nearby. In all cases, it is best to bring the animal to veterinary clinic as soon as possible, or if possible to have a veterinary come and see the patient. Vital parameter. The first thing to check in case of doubt are the vital parameters of the animal. Conscious level indicates the ability to respond to external stimuli of the animal. Depressed, he responds little to external stimuli but is conscious. Torpid, he tends to sleep. Responds to painful stimuli but does not want to get up. Woke. Comatose, he doesn't respond to stimuli, not event. Painful, deep sleep. Hyperexcitable, exaggerated response to external stimuli. Convulsion. Extreme hyperexcitability may lead to loss of consciousness. Pupillary reflection. The pupil of a healthy animal reacts to stimuli as it is controlled by the central nervous system. Normally the pupil widens or shrinks according to external light, but there are stimuli that change its diameter, such as emotional states, which usually increases the diameter when the light stimulus has different effects on the two pupils. There is something wrong. If both pupils do not respond to the light, things go very badly. You need to take them to the vet urgently. Respiration. Breathing, as you know, is necessary to live. It is one of the parameters most affected by emotions, and this can deceive you. Eupnea is normal breathing. Effortless. It happens at the level of the nose. Chest rises and falls rhythmically. Usually a dog breathes between 8 large size and 20 small sizes times per minute. Dyspnea. The mouth is involved beyond the nose. Loud noises of breathlessness. Dyspnea is normal in extreme heat or prolonged physical exertion. In these cases is physiological. There are also altered respiratory rhythms, typical of disease and shock states. In these cases we may have intense dyspnea followed by normal breathing states without external variations, or continuous dyspnea at rest. Pulse. This is a measure of cardiac output. In dogs it is easier to take it to the height of the femoral artery. In a dog it ranges from 80, large adult dog, to 160, puppy, small dog, beats per minute. To measure it, count the pulses for 15 seconds and multiply by 4. Tachycardia. When the heart beats too quickly we speak of tachycardia. Like breathing, it responds to several causes. Physiological, in response to intense effort. Emotional, fear, anger. Pathological, dysfunction of the heart that is not related at the moment or that recurs by itself without external intervention. Bradycardia. When the heart beats too slowly. Bradycardia occurs. There is no physiological or emotional bradycardia. The cause is always pathological. Time of capillar filling. It is done on the mucous membranes. It is the time it takes for the mucous membranes to return to the normal color, pinkish or red depending on the dog. It is performed on the mucous membranes of the lip, applying a short pressure with the thumb and counting the seconds before returning to normal color. If all goes well, it takes 1 to 2 seconds before the color changes back to pink. If too much time passes or there are no significant color variations at the pressure, there's something wrong. Other verification mucous membranes are those of the conjunctiva. Explore by lowering the lower lid. If the mucous membranes appear the wrong color, too red, yellow, too light, stained blue, there is something wrong. Some dog breeds have different colored mucous membranes, especially gingival ones. There are completely physiological. Temperature. It's easy to take with a normal thermometer. In dogs the best way to do this is by rectal, even if you now find ear thermometers. The dog's basal temperature is higher than ours and on average is 38 to 39 Celsius degrees 100, 3 to 102, 3 Fahrenheit. Hyperthermia. When the temperature is over 39 degrees including 39.5 about 102, 3 to 103, 1 Fahrenheit. If the temperatures is above this value, 40 degrees or more 104 Fahrenheit, you have a high fever. While for us the fever goes from 37.5 to 40 degrees, 99.5 to 104.9 Fahrenheit. For a dog it goes only from 39.5 to 41, 103.1 to 105.8 Fahrenheit. Beyond these values it risks life. As for us, hyperthermia can result from an intensive effort, but it falls within a few minutes, in this case, hypothermia, when the temperature is below 38 degrees, 104 Fahrenheit. This is a serious symptom, because normally the temperature never drops below this value. The only exception is the bitch a few hours before the birth.